Hello and welcome everyone to today's webinar, Teaching Healthcare Quality, Adopting the Case Method to Engage Students, presented by Springer Publishing Company and featuring Dr. Zach Pruitt, the lead author of the newly published textbook, Healthcare Quality Management, a Case Study Approach. My name is David Diadana, and I am the senior editor responsible for the Health Administration and Public Health Publishing programs here at Springer Publishing. For those who do not know much about Springer Publishing Company, we are an independent publisher known for innovative textbooks, professional references, and clinical products in the fields of nursing, behavioral and health sciences, and medicine. Before I introduce Dr. Pruitt, please note that this webinar will be recorded, disseminated, and posted on our website in case you miss any part of the presentation. And we will also be taking a few questions at the end of the presentation from the audience and through the Q&A feature on Zoom. Please feel free to send along any questions as we go during the presentation itself. I am pleased and honored to introduce Dr. Pruitt. Zach Pruitt is Assistant Professor and Director of Community Practice at the University of South Florida College of Public Health. He holds a Master of Health Administration and PhD in Health Services Research from the University of South Florida College of Public Health. Dr. Pruitt teaches graduate and undergraduate courses in health administration, public health, and medicine. In addition to quality management, he teaches courses in strategic planning, marketing, and consulting practices. So Dr. Pruitt, I will now hand the presentation over to you. So Zach, you can take it away and remind people about today's agenda.
Well, great. Thank you very much, David. I appreciate that and everything that Springer Publishing Company has done, and appreciate the support of Erica and Jacqueline behind the scenes to help get this set up. So yes, so today, teaching healthcare quality, adopting the case method to engage students. My co-authors, Dr. Candace S. Smith and Eddie Perez Ruberte, these co-authors are amazing and helped incredibly well in producing this textbook. Dr. Smith is a chief nursing officer, and as you can imagine, during the pandemic is busy with the response and setting up her employees and making sure they have what they need. Mr. Perez Ruberte is a Lean Six Sigma expert and engineer, and works for a large health system doing performance improvement. We weren't sure if he was going to join us today, but I think he may be on. Lots of preparations in terms of performance improvement, working with the clinical teams to set them up with COVID testing and the like. So I want to give my thanks to my co-authors first and foremost for all their effort and help and vision for getting this done. So as David said, I'm an assistant professor and director of community practice at the University of South Florida. And today's agenda includes how to apply principles of quality management in a team-based learning environment. So in class or online, how to incorporate quality management data sets such as discharge data, medication errors, surgery timestamp statistics, into these Excel-based assignments. And finally, how to apply quality management philosophies, such as Lean and Six Sigma, to real-world healthcare issues found at inpatient, outpatient, managed care, and long-term care settings. And before we get started, I want to thank all the attendees to today's webinar. These are really scary times in the COVID-19 response. And I know a lot of my friends and fellow instructors and professors are under an incredible amount of anxiety and stress, not only with moving many of their in-class classes or courses online, but also maintaining contact, engaging their students during this really stressful time. So I know it's a great pleasure for me to be able to talk to you about healthcare quality management, something we've worked on for a couple of years, and give you some of the tips that I have for engaging students in the case method to teach healthcare quality. So thanks for that. But really, it's pretty simple. Today's webinar, you will learn how to engage students in class or online in this healthcare quality management content. Okay, so to frame what I'm talking about today, I want to compare and contrast the two different styles of learning. The first is traditional, as it is contrasted to problem-based learning. Traditional learning is what I learned, how I had classes throughout entire graduate school. So, the professors told me what I needed to know, and I was told, you got to memorize this, and then they would give me an assignment or even an exam or some sort of assessment to see whether I could illustrate how to use it. And so that's how I started teaching. And I would do the sage on the stage thing and, drop some knowledge on the students and then have them apply it. But what I learned is problem-based learning is a much more active style, less passive, more active style of learning that students then can demonstrate their application of the information that you're trying to share. And it flips it on its head. First, you assign the problem. Then you help them by identifying what they need to know, giving them a framework or tools or approaches for applying that. And then the students go off and learn it by themselves. They apply it to the problem. And that way to learning is traditionally done in medicine and many in engineering and business school. These are approaches that have been used in various contexts that they think works. And according to Hemlo Silver and Eberbach, the problem-based learning process has 6 steps that follows that order that we just showed you. First, have the students explore the scenario. These are always ill-structured problems, wicked problems, not easy to understand, complex. And this is the problem, go solve it. And you have them, in the second step, you have them engage in self-directed learning. This is independent learning. So not you, this is what you do, but rather the student going and finding the information and applying new knowledge in that third step. Oftentimes you'll give them the tools and approaches to be able to solve that problem. And we'll talk about what that means in a little bit. And then you have them collaborate in small learning groups. Best type of learning in these teams. They debate, they cooperate, they figure out what the best problem definition, the best solution, and how to deliver that solution in an effective way. And all along the way, we as instructors are just giving guidance, asking clarifying questions, saying, have you thought about using this? Or what happens if you do that? Are you sure this is the best? Very little, this is the answer. Problem-based learning is pretty nebulous in a sense that there's no one right answer. So you're just guiding them. And then maybe the last and funnest part is reflecting on new knowledge. You can imagine how active problem-based learning is so successful that when you get them to the discussion phase or reflection phase, you have a really rich conversation or writing about what they've learned. Because it isn't rote, it wasn't memorized, it was discovery that you get to reflect on. And it makes it really fun if you can commit to problem-based learning to hear how much the students have learned. So I wonder, amongst those on the webinar, if you could answer this question for me so I get a sense of where you're coming from. Do you use the problem-based learning approach in your quality management course? So there's some options there. I'd like to see if it's yes, no, but you're planning on using it. I don't know if I've already sold you on the concept, or if it's not applicable. If you could take a minute or two to vote there. Well, great. Looks like a majority of you are already using it. That's fantastic. That's the way to do it. You know that active learning is the best kind of learning. So you may already know then that problem-based learning is an approach that can incorporate the case method. The case method, they're actually separate approaches. So you can apply the case learning method to problem-based learning style, which follows that 6-point process that I just shared with you. And the majority of this webinar, I'm going to walk through how in the in-class or online version of your courses, you can apply problem-based learning using the case method. Case method has it meets all 6 of those process steps that I'll share with you in turn. Complex problems like ill-defined, wicked problems. It provides a framework for individual problem solving. So if you may have those approaches already taught by sharing quality management tools and approaches that are famous in healthcare quality management, Fishbone diagram and the like. And then, of course, you can assign them to groups and require team collaboration, require formal individual and group assessment to understand their learning at the highest level possible on the Bloom's taxonomy, and then guide the reflection and discussion. So all of those elements of the problem-based learning process can be applied using the case method. Now, a quick note. This approach, or these approaches, using case method with problem-based learning, can be used in both in-class or online. In class, the same format as you're used to, but instead of lecturing, you're giving the students the problem firsthand and starting off the bat. Online, it can be done exactly the same way in assigning the cases, having them walk through independent learning and going into groups. Now, if you teach in-class classes and are moving many of these courses to the online environment, the problem-based learning using the case method is really ideal. It really requires the student to take the extra level of engagement and active learning, quite different than just recording lectures or lecturing at them through video conference. And so I think it's ideal for that. So I wonder if we could ask the audience, which modality do you use to teach healthcare quality management? Do you do in-class or online, maybe a hybrid, flipped version of that class where you do a little bit online, a little bit in person? Or do you teach both? You know, some students, some teachers will teach multiple courses, sections, and one is online and one is in person. I know I've done that before. Or maybe it's not applicable. Maybe you don't teach healthcare quality management yet. So, okay, great. Well, this is wonderful. So most of you are already teaching online. Some of you do a hybrid. These are the times, right? So delivering healthcare quality management content in the online environment is already being adopted, and that's great to see. This is the way we think to deliver healthcare quality management content that best engages the students in the learning. So the application, the active learning. We love case studies. We think it's great for solving problems. The case studies should be, though, very complex, realistic, challenging, credible, intricate, ill-defined, plausible, all these things that we think the best types of cases are such that the student doesn't know exactly what the right answer is. And in fact, there probably isn't a right answer. There are multiple right answers. And it's the application of how the tools of quality management to these case studies that's so important. Now, this part, case studies, is a personal preference. Candace, Eddie, and I believe in the storytelling and case studies. We are influenced greatly by the great Anthony Kovner, who is an author for Springer Publishing, and he's one of my favorite case study writers, and he knows how to write with plot, conflict, characters, and settings. And that inspiration had us write 25 cases with we tried as hard as we can to have good stories that stood on their own, and we had a blast doing it. Some of the cases one was a sepsis case where a mom almost lost her son and the drama involved with that and the mistakes that can be made throughout the process. Another one is a sleazy lawyer giving a deposition to the chief nursing officer after this event happened where it was a failure to rescue. You can imagine the chief nursing officer and I had a great time talking about this, how that might go down. We have one about whether the the surgery director was going to keep his job or get fired if he couldn't increase the utilization of the operating room? And can the students help save his job? And we have one about a hurricane that comes through a community, disabling the scheduling process for outpatient appointments. And the students have to identify how to best recover in that scenario. So all of the 25 cases, we try to have it be fun and interesting and dramatic in the storytelling. It's really important to us, although not necessarily required. You may prefer to have cases that are a little bit more dry, but we love the good stories. And we have all the same information in terms of facts, but it's just set up in a story. All right, so let's transition now to talk about the framework that's necessary for students to solve these healthcare quality management problems. So I'm curious, do you already have a framework that you use? Do you use Lean or Six Sigma, or maybe you use a different methodology altogether? So the Minnesota method perhaps, or design thinking, or maybe total quality management. Or do you use a combined approach, which is fair? You might do Lean Six Sigma with an element of what's called evidence-based management. You might do lots of things. So I'm curious. Okay, yeah, makes sense. A combined approach. Hey, Lean and Six Sigma are famous. They have great tools and approaches. And frankly, this is how we wrote the book. We were agnostic about what framework you should use. We thought that it was best to expose the students to these elements and explain that it's just the way of thinking, the scientific approach that matters most, the mindset that's so important. So this is not a Lean book. It's not a Six Sigma book. It's none of that. It's just all of the explanations giving the student an idea of what these approaches can be. But we do recognize that these have great frameworks. Lean has the plan, do, study, act, continuous quality improvement cycle, PDSA. We understand that Six Sigma has a great way to do it too: define, measure, analyze, improve, control, DMAIC. So another continuous quality improvement approach that is fantastic for helping students problem solve. What we've done in this textbook is use an activity that adopts the Lean tool called the A3 problem solving template. Now, if you haven't heard of this A3, no problem at all. It essentially is a structure for the student to document and take them through the various steps of continuous quality improvement. The A3 just refers to really the size of the paper. It's not 8 by 11 that goes in the printer. It's a bigger, more like a legal 11 by 17. A3 just refers to the metric size that they use in Europe and Asia. So A3 problem solving template, really easy to learn. We've included it in chapter 6, walks through each step of that. So we think it's a good way to do it because it really follows the other cycles. I mean, just as an illustration, A3 is very similar for PDSA and DMAIC cycle, and that it's each step: plan, do, study, act, or define, measure, analyze, improve, control. So it's to your preference how you can frame the steps, but nevertheless, this A3 problem solving template is a great way for them to guide them, to provide a framework, and also for assessment. So here's the example. So you got to teach them the quality management tools and approaches for them to use as the framework to solve these, ill-defined and wicked problems. And this is the A3 filled out. In fact, what this is for one of the cases on patient navigation at the orthopedic clinic, right? So this is what you as an instructor, if you adopt the book, you'll have access to this particular solution, but you could expect the student to do something very similar. And you can see how in this case, the theoretical student would apply the Fishbone diagram here. So in the problem analysis or root cause analysis stage, they may employ this famous root cause analysis format called Fishbone or cause and effect or Ishikawa diagram. But there are other tools, value stream map, famously lean, taking through the process, in this one for patients, showing how it's scheduled the cases, and it goes all the way through the process with the bursts there showing the delays. You have a Pareto chart. I would maybe consider this a Six Sigma tool, although used in lots of different contexts. This one for patient complaints. But we have 25 different quality management tools and approaches. And this is a matrix that comes in Appendix D. So you basically don't have to teach them the tool beforehand. It matches a tool to a particular case. Again, in the problem-based learning, you want to deliver the problem to them first and have them do self-directed study. Oh, but Zach, how do they know? Well, it matches it. And you can also then show you can do a checklist with any of the other cases. So again, this is really important for their self-directed learning, to give them the tools, but not to just over-explain things. People learn much more actively when they have to identify what would be best. And so we explain each of those 25 tools, and we match them to a particular case where it really works. All those students can use it with any of the cases. Now, creating case study teams is fundamental to problem-based learning. Now, I'm lucky at University of South Florida, we have Canvas, which I think works great. In the in-class version and online, I have a tool that can easily take my roster and assign to various groups. I can have the same group throughout the semester. I can rotate it through. And of course, this works in the online version as well. Blackboard and other learning management systems all accommodate this. But again, you want to have individual learning followed up by collaborative team-based learning on this healthcare quality management learning. Now, real-time collaboration is a key. I don't think that asynchronous works quite as well for student discussion of these cases. They're messy. There's a lot to it. And do we first agree on the problem definition, et cetera? Now, the technology, as we're finding out in the pandemic, that it really accommodates a lot of these real-time collaboration well. The learning management systems such as Blackboard or Canvas both have these tools, but we use Microsoft Teams. Today we're on Zoom. All of those manage well with real-time collaboration. I know that a lot of these you can set up a full group, so you could have your whole class on at the same time, and then you can break them out into Zoom rooms, for example, to have them collaborate, and then you can bring them all back into the main room for discussion. So the technology works for problem-based learning, applying the case management approach, the case study approach, in both in-class and online. The technology is absolutely there, and I'm sure you guys know this, but I would encourage heighten your engagement through real-time collaboration. Now, again, you want to assess at the individual and group level. I don't think that group work alone is effective in understanding a student's attainment of their competency. I firmly believe that individual self-directed learning needs to come first. They need to struggle. They need to, it needs to be pretty hard to be able to say, I don't know what the right answer is. Let me try to figure it out. And then get together as a group to collaborate, to debate, to figure out what works best in terms of the particular problem at hand. Now, I've used these are the A3s from the same case, just done in different ways. Again, case study, there is no one right answer. So these both are right. In the example here, the individual and the group, they just happen to be quite different about how they did it. We provide instructors for every case in the casebook, a solution for the individual and for individual and the groups. In other words, there are two different solutions provided to you as the instructor. One, the authors created. So Eddie Perez Ruberte, the engineer that co-wrote the book with me, would develop the A3. And then we had students develop the other A3. So you get kind of both levels of feedback on solutions, if you will, on those case studies. Oh, great. Another way to do it is case competitions. So many of you have heard of the Clarion case competition for interprofessional collaboration, bringing together nurses and doctors and health administrators. That's a great example. And it's always something quality oriented, community oriented, and much like these case studies. And so in my classes, I love to set up case competitions. And I don't do it right out of the gate. I let them practice as teams and get together and learn how to develop the best collaborative flow, if you will. But then I love doing the cases towards the end. And so, because they get into it, they really like seeing who's going to develop the best. And they like to not let down their team members, right? So nobody likes to not do a good job, and they don't want to feel like they're letting their team down. So they work really hard. And what I usually give is, 5 points for the best team and 4 points for the second best team, and so on and so forth. And, there's always a lot of ties and congratulations all around. But if you set up a case competition, it's super fun. And you can do that online, of course, and you can do that in the in-class version. I've started doing on my online class, having them record it and then send it to me through the collaborative tools. And it's been great. Really works. Super fun. Well, finally, in the problem-based learning, you want them to reflect and discuss on what they've learned. This is really the best part, I tell you. You see how much the students have learned through problem-based learning. As many of you already know, they have a depth of understanding of the material. They've already wrestled with the material. So by the time they get to reflecting, either writing or speaking in discussion, you can understand how much they're at what level that they understand. And it's not just competencies of healthcare quality management. So we wrote our cases to cover lots of different types of competencies. The obvious one, of course, is healthcare quality management, performance improvement, those sorts of things. But when we wrote it with the health administrator, nurse, physician, and interprofessional team in mind, we mapped out their competencies for each of those professions to understand which case met those competencies. So in chapter 5 of the textbook, it walks through competencies like community collaboration, interprofessional understanding, professional and social responsibility. Those are competencies taken from the NCHL competency list, but many of these are hard to assess because they're not just lecture and exam sort of material. You got to make sure they understand interpersonal relations. And so we think that the discussions and reflections, all the questions and cases in the textbook, can help you assess at a very high level in terms of Bloom's taxonomy, these competencies through the discussion questions and the case content itself. So now shifting a little bit, when we sent this proposal out to professors to review the idea of this healthcare quality management casebook, they all said, we love the idea of having data sets. And we listened. We had conceptualized the idea of having some data, but they needed it. And I know how hard it is for me to find data sets that my students can use. And so with Eddie and Candace, we worked really hard to give you data that you can use. This is an example of an A3 where a student, went deep on these ED data that had, disposition, severity level, wait times, length of stay, really in depth on that. And we provided a lot of data sets that we got from the community and just de-identified them. We have one that's timestamp data with thousands of lines of data, but of course it's de-identified, but very useful, we think. Now I'm curious, how many of you use data in your courses now? Do you use small data sets, some big ones, or both? Or maybe you're just learning and thinking about adopting it. I'm curious. I think I've got some good really engaged professors on this webinar, so I can imagine. But you probably know how hard it is to find good data sets that are both realistic and big enough to allow your assessment of their data analytics skill, which we all know is super important. All right, good. Like most of you have small data sets. Well, listen, if you're looking for thousands of lines of patient data, very realistic stuff, this has it. So that's good that you are using data sets. So we agree that's how it should be done. They need to have, all types of professions need to have basic data analytics skills. And so imagine the Excel data that we give you. We always provide the solutions to instructors. So the student will get just the raw data, but each case that has extensive data will also have the solution file, if you will, the instructor file that has all the instructions to it. In this example, this is that same case that I showed you, the A3 above, with encounter data. You have the when they were checked in and what their severity level at the ED, length of stay, etc. Now for the instructor though, it has pivot charts and tables, and we even did some ANOVAs to make some points about the differences in the means according to couple groups. So you could go pretty deep on this, and we provide data dictionaries to students and instructors to explain the fields. We also give instructions in these files on how to formulate certain Excel tricks, like VLOOKUPs and those sorts of things. So special shout out to our engineer co-author with a lot of these skills, and Master of Health Administration programs will like to hear that you can use this data. So 15 extensive data files with a matrix in Appendix B. So check that out. You can see which of the fields have pretty big data and that sort of thing. So check that out, Appendix B. Now shifting slightly, I want to share 4 main types of health quality management case studies and how we link the tools, both Lean, Six Sigma, and other methodologies to these types. Process improvement, patient experience, patient safety for the clinicians out there, especially important, and then sort of a catch-all performance improvement type where we include different types of community like opioid addiction and ED and suicide prevention from the community and those sorts of things to provide a broader flavor of types of case studies. So here's an example for process improvement, of course, the famous Lean tool, swim lane diagram. This applies to a case on home healthcare. Patient experience, here's the control chart, famous for Six Sigma. This one on patient satisfaction. Patient safety, the failure modes and effects analysis, evaluating the various risks for certain potential failures. And this applies to patient safety. So one of the cases directly applies the FMEA. And then, of course, the broad performance improvement category. This is a fishbone, a whole section on explaining what fishbones are, the Ishikawa diagram or cause and effect diagram. And again, you can use these tools, of course, on any of the cases, but they're explained and tied to very relevant cases to explain the context. Now, of course, we want to help your students understand the context, the settings of healthcare. That's really important to understanding how to apply these tools. We have cases on outpatient, inpatient, health insurance, managed care, long-term care, and home health care. All of these are represented in the textbook. Each of the cases have podcasts recorded with healthcare experts in their area, in outpatient and inpatient and managed care and the like. These podcasts give a flavor of the difficulties of solving cases that are very similar to the case studies in the textbook, and explain certain career aspects, what they think is important, what they think is important to tell students, those sorts of things. They're short, they're maybe 10-minute long podcasts, but our feedback so far is really important to help students understand the real life scenario. Healthcare quality management is not easy, and it's nice to hear these experts agreeing it's not easy and saying you have to follow the tools and get better at it. You can improve healthcare. So we match each of the case studies to the healthcare setting matrix. So for example, the summer internship journal, that's the case number 1. It applies to an inpatient or academic medical center setting. The claims payment processing, a very detailed, fun case on representing managed care organizations, and so on and so forth. So we give you if you're an instructor, you don't have time to read all the cases and understand each one. I don't. So we wanted to make it as easy as possible for you to match the settings, all types of information, competencies. They all have matrices associated with them to help you match the right case for your course. Well, with that, I want to thank you all for joining us in this webinar today. It's been a real pleasure to be able to explain how to engage students in healthcare quality management through the problem-based learning and using case method. We're really excited about the casebook. We're excited about teaching students, especially in today's online environment demands, and we think it can really work for you. But I would like to open up for some questions if you have any.
Great. Thank you, Zach, for that presentation. We will now be taking questions. So if you have a question for Dr. Pruitt or for Springer, please send through the Zoom Q&A feature. And we already have some already. Zach, so back to, I guess, when you were talking about converting the classroom and also breaking out into groups, what size groups do you recommend going through some of these problem-solving cases?
I recommend 4 or 5, no more than 5 for sure. You get free writers, essentially, people who just sort of sit back if you get any larger than that. So 3, 4, 5 maximum is how I would set up the groups.
Okay, great. I have another question. What level, I guess, is your textbook focused on? What instructors should be most excited about this, and explain maybe how they can be used in different programs.
All right. Well, I use it both at the undergrad and graduate level. So we wrote cases to be understood by undergraduates from the content standpoint. So what you'll find is a very easy read. Part 1 explains the basics and walks even the beginner through with a pretty easy to read context. The cases themselves, while entertaining, they are complex. And so you have to pick the right cases that I think apply. And some of them have extensive data analysis, which I think would be more appropriate for the graduate level. And because I wrote those with, and my co-authors wrote those for the graduate level. So you can use both. I think it's just a matter of which case matches the students the best. But some don't require a lot of in-depth knowledge of healthcare and or data analysis, and those are appropriate for undergrads. For example, we have one that's written about patient experience and quiet at night that really just the students have to do a fishbone diagram is their analysis, and it's pretty straightforward and fun. But I just did that maybe a month ago with my undergrads, and it's great.
Great. Another question: is there an instructor manual that comes with the text? So it's so all those features you were talking about for the instructor, are they in one place, or how are they set up?
Yes, great question. Yes, we wrote a pretty extensive instructor's manual with summaries of all of the cases with recommended tools for each of those cases. So you could use the fishbone, you could use the swim lane diagram for this one, for example, explanation of the case data analysis and how that would work. So yeah, we have a very extensive instructor's manual In addition, we have PowerPoints for each of the chapters and the cases that walk you through the process, and all of the discussion questions, both in the instructor's manual and in the PowerPoints, have the answers with them, or ideal answers that we spent a lot of time working with a pretty remarkable student that helped us make sure that it passed the muster, and she did a great job, was able to write those down for us, and we edited them, provided answers to you.
Great. And could you also explain again how the data files are done and where and how you divvied them up?
Right. So each case that has data files has both a student version and an instructor version. And so students will only have access to that student file. The instructor version's same as the students, except that it has basically the solutions to it. So all of the analysis, all of the data manipulation, and including all the steps to get to that point. So we wanted to make the adoption as easy as possible by providing the instructors with the instructions how to do it. There's no need for you to go through and solve them yourself. We've already provided it to you.
Right. And we can, at Springer Publishing, we can help any instructor get access to the instructor files for the data sets, as well as the instructor manual itself. You will go through the process of, writing your information about your course to get that sampler, and to also get the instructor resource sampler as well. So we have a question about this being, a primary text. You use it for your full semester in course.
Yeah, it is a primary text for sure, but it introduces the quality management concepts in the part 1 of the book, and walks the students through the challenge of healthcare and how it's adopted from scientific thinking, the mindset and the culture required, including change management. And then it explains sort of how to apply the casebook and some of the tools that you might use. So yeah, primary is definitely the way to do it, because it's an application. It's an active learning textbook. Yeah, full semester, and you could apply multiple cases each week. You could do 1 case a week. So there's plenty to choose from if you wanted to maybe do an introduction week, and then cases each week, and then build towards, maybe a case competition, sort of more formal presentation component to it. So there's plenty to choose from depending on how you want to divide it up.
Great. I have a question from a nurse working. Would this help nurses work in the field to set up a QA/PI?
Oh yeah. So Eddie Perez Ruberte is a performance improvement teacher for a large health system. So he runs these Kaizen events for nurses, and it was written for that idea in mind, right? So it was, all right, adopt these cases and in your health system to teach how to do it. So it provides a solution set for instructors of performance improvement, and so that you can guide a team on how to learn it. And really, it's all about the mindset, right? So you imagine Eddie just keeps saying over and over, it is the mindset. It's not the tools. It's not Lean. It's Six Sigma. It's the way of thinking. And so your students in the healthcare settings will gain that mindset, so that when they go back to their units, they'll have that view already.
Great. Another question I had, you mentioned the podcasts from an attendee. You mentioned the podcasts. Is there anything, else you recommend, I guess, in terms of multimedia or, helping online courses and engaging people?
Oh, I think IHI is the way to go. The Institute for Healthcare Improvement has so many cool modules. I would recommend you integrate that for multimedia opportunities. Yeah, the idea was to have multiple views or perspectives for each of these cases, and that's why we had the podcast. But that's what we do. The IHI is great, and there are many other tools for that. But great job. Yeah, you got to include many perspectives.
Great. And another question from an attendee. Is this valuable for a CPHQ prep?
I think in the terms of the mindset, and if you want to know how to apply these, I would use that. So whether it'll help you with certain components of risk management and some of those other components associated with that certification, I'm not entirely sure. But if you want to be very confident in your application of the material, then absolutely, this is the way to do it.
Great. And, given that there are other, resources out there, do you ever use other resources besides IHI or, the cases here?
Well, yeah, I'll use YouTube videos and the like. So yeah, I think it's really fun to have lots of different uh, components. I don't want to overload them, but giving introductions, sometimes I'll do video introductions to the cases and that sort of thing. But again, these are pretty fun and pretty difficult. So the students will have a lot on their hands. So make them brief, make them interact, make them engaging, but don't overdo it.
Great. Any more questions? Please send them through the Q&A feature. I'll give a few more seconds. Thank you all for attending during this strange time. If that is all for today on the questions, we can move on to the end here. All right, so thanks again for joining us. Please visit us at www.springerpub.com/Pruitt for more information on the textbook, including how to review the book, the instructor materials, and the podcasts, or feel free to send us an email as well. We also have a short survey at the end of this that will be sent out to all the people who registered. So please review that and send in your thoughts to the webinar itself. We'd really appreciate it. And as we close here, please stay safe and well during this unprecedented time. And thank you to all the healthcare workers on the front lines and those supporting them. So we greatly appreciate that. We can also accommodate desk copies to anyone who is at home, based on supply chains and stuff like that. But we have e-samplers that we can send you. Thanks so much. And thank you, Zach, again for leading this discussion.
My pleasure. Thank you. Thank you, everybody.